South Africa's once world-leading HIV program is on the brink of collapse. Now, that's according to Professor Francois Venter, a clinician researcher at the University of the Witwatersrand. The US has suspended foreign development assistance globally, including the President's Emergency Plan for AIDS Relief and National Institutes of Health Research grants. Now, South Africa has the highest number of people living with HIV in the world, with nearly 8 million people in need of lifelong antiretroviral medicines to stay healthy. However, Health Minister Dr. Aaron Motsoaledi said that funding cuts for HIV programs will not affect access to free ARV treatment that millions of people receive. But for more on this, we are now joined virtually by a clinician researcher at the University of the Witwatersrand, Professor Francois Venter. Professor Venter, thanks for your time. Welcome to Morning Live.
Hi, everybody.
So, Professor, with what is happening now globally with the funding cuts by the United States particularly, what are the signs that show that South Africa's HIV treatment program could be unraveling?
So the first thing is that our testing program has almost completely stopped, and almost all prevention programs have stopped, particularly to key populations, people who are very, very high risk for HIV. The LGBTI populations, sex workers, drug-using populations. There was this highly efficient group of NGOs that were delivering these services across the country, and overnight these services were stopped. And there's no plan at this point to actually to provide these services. The Minister and the National Department keep saying that there is a plan in place to replace these, but we see no evidence of this plan, despite repeated pleas by civil society to see evidence of this plan. There have been 2 meetings with civil society and promises that a plan will be made apparent, but there's no funding, there's no plan. And I must tell you that what makes me feel bleak is we're seeing evidence across the country of the unraveling of the program. We're seeing no testing. We're seeing reports from patients of them not being able to get access to services or getting treatment. So despite the minister's reassurances, we are seeing the program unraveling at the moment.
Now, with this donor funding shrinking, how do you believe government should intervene to save South Africa's HIV treatment programs?
So, to be fair to the government, this was overnight, literally overnight. You know, a lot of these services were just stopped. On Monday, there was an announcement that the funding was going to be cut, and Tuesday these clinics were closed. So there wasn't much time, but we've had 4 months now of just sitting on their hands and not doing anything, despite repeated warnings that this was going to happen. And I got all the figures 2 days ago reporting, all the laboratory measures from across the country of how much this is starting to unravel. And we're going to start seeing an increase in deaths now, an increase in hospitalizations, an increase in new infections, increased number of babies born with HIV across the country. I guess everyone watching this is thinking, we haven't heard much about HIV in the last 10 years, and that's because the program has been working so well, and that's going to stop now. We've got the program that is really going to start falling apart. What the government should be doing now is going to those NGOs and starting to work on a program with them to make sure that this starts transitioning across to the Department of Health. And that's going to take 2 or 3 years at the bare minimum to move those services across. It's a highly specialized service that they're talking about. It's not something that you can just simply shove onto the primary healthcare clinics, which are already stretched to capacity in many parts of the country, and expect them to just pick it up. And at the moment, we're just getting sort of directives issued from the National Department to the provinces with no sense of, and no additional resources and no idea about how this is going to be executed.
Professor Venter, so South Africa has, of course, made enormous progress in expanding the number of people who are able to access treatment for HIV, and that has resulted in a 66% decrease in AIDS-related deaths since 2010. But if we look at that, one has to ask the question about why are we still seeing such high infection rates in South Africa, given the resources that are being put to use here?
So we've actually cut our number of new infection rates down dramatically from 500,000 a year down to 170,000. And there were efforts about to be done before this funding cut to maybe bring that down to as low as 30,000 with some of the new technological interventions. A lot of those were tested by researchers here in this country. So we really were on the brink of bringing HIV rates down right down to where, it still would be a problem, but nothing like we had 15, 20 years ago. So it's incredibly disappointing that we dropped the ball at this point. So when you say we threw a lot of resources, yes, we did, but we threw a lot of resources appropriately at a health problem that was the number one killer of everybody, of men and women in this country 15, 20 years ago. It's now number 6 on the list, So we've made it's the one thing in the Department of Health could rightly be proud of. So I think what I'm feeling so bleak about is that to drop the ball at this point because of a foreign power holding us hostage at the moment just seems like such a silly thing to do. When we should be throwing every resource, it should be the country's number one priority at this moment to save this program.
And speaking to that, of course, what can be done practically? Because as you rightly acknowledge, this was not something that was anticipated. It is something that came as a surprise at everyone the world over. But what can we do if we look at things like the support that perhaps can be given to young people, women in particular, just to drive home that message of prevention, a little more strongly? What do you think can be done?
This country has the experts. We've been doing this for 20 years. The Department of Health needs to acknowledge, both within the department, but also outside the department, that it has the expertise to do this and needs to put those people in the room and come up with a practical plan. That expertise doesn't reside only in the Department of Health. It's going to have to throw money, resources, and actually be open to acknowledging that expertise and making it happen, put together a management plan. It's not simply a question of money. I think in my province in Gauteng at the moment, we can't even feed patients in the hospital at the moment, so it's going to require more than simply the Department of Health to execute this. It's going to need urgency, and it's going to need a whole lot of experts in the room to put this thing together. And it's not going to be simple, but it also needs things to move. We can't sit around for 4 months waiting for things magically to happen. And at the moment, it just seems like there's just no sense of urgency or accountability from the department. There needs to be acknowledgement that there is a problem. And the minister at the moment seems to say, just give me lots of money and we'll make it happen. And this is a highly specialized area of the HIV program that needs to be focused on. And those experts are sitting in those NGOs and sitting in the whole of the programs outside of the department. They need to be brought into the room to put that together. So a lot of what you're talking about needs to be put in the appropriate hands and acknowledged as such. But it's not going to happen if it's just simply put in a whole lot of memorandums and sent by email to the provinces. It needs to be actioned appropriately.
And then, of course, just sticking with that message and, how we actually make sure that we try and not regress too drastically at this point, Dr. Venter. If we look at things like PrEP, I heard, the most fascinating but also scary story not so long ago about how young people continue to engage in unsafe sex and then go and take PrEP after the fact. And that absolutely horrified me. So those messages and addressing stigma attached to HIV and AIDS still in this day and age, are we doing enough on that front to make sure that we engage sufficiently with people?
No, I don't think we are. And I think there's evidence that educational messages have fallen down. Again, that sits at the feet of the Department of Health and sits at the feet of the Department of Education, everybody else, is that we haven't paid enough attention to HIV. And again, there are a whole lot of new technologies that could be put forward there. And again, we need to acknowledge the fact that ours is a very conservative country and that people like the Department of Education have stopped us putting these education programs within the schools. We've had to fight the teachers, we've had to fight the parents and things from getting the appropriate messages into the schools. And, pairing HIV education programs with proper reproductive education of our kids needs to happen. And again, because we've been so effective in terms of treatment programs, a lot of this problem has gone away and the urgency of it has gone away. So a lot of what you're talking about, if I was a kid at the moment, I would do exactly the same thing because that's the only option I would have in front of me. So maybe this is the kick that we need, is to take HIV more seriously. But at the moment, no one seems to be taking it seriously. And what this is going to translate into, and I don't want to be alarmist about this, is our hospitals are going to be overrun again. You know, people are going to start dying again, and children are going to start dying, going to be born with HIV before the end of this year. So a problem that has not been a problem, or not much of a problem for the last 10 years, is going to start becoming our major health problem again, because no one seems to be taking it seriously at the level of the Department of Health or within the presidency. You know, this is as big a problem as we need to be thinking about in South Africa at the moment. And what you're talking about is something we've been just kind of been having on autopilot, which is the education of young people about the risk of HIV for the longest time. But we could have broken this problem in the last 10 years and we've been taking it more seriously.
And just a final one, Professor Venter, regarding funding and closing that gap. The private sector, and I know everybody is buckling under, the pressure of the current economic situation, but how do we convince the private sector that they also have a role to play here and perhaps come to the fore to try and plug that gap?
I think part of this is management, and I think most of it, the way we fixed Eskom, we've got lots and lots of experts into the room to fix Eskom. And I don't think it's just a question of money. I think it's a question of political will and putting pressure on the various parties that need to sort this out. There is plenty of money within the health system at this point. What we don't have is the kind of pressure on the various people who are spending that money to do it properly. And I think the role of the private sector at this point and the civil society is to bring the requisite expertise into the room to fix our health system more broadly. Our HIV program and the sudden collapse of the HIV program is just a symptom of the fact that we're not running our health system properly, and our public health system in particular. The role of the private sector is to come and help us sort this out and to be part of the solution. And to be quite frank, there's problems in the HIV program in the private sector as well. So everybody does need to get into the room to fix this. It's not simply going to the private sector, cap in hand, saying, give us lots of money. Pouring lots of good money into a bad system, it just means we're going to spend it badly. We need to work out what needs to be done. And the private sector needs to be part of that plan.
Well, Prof. Venter, thanks so much for your time this morning. Professor Francois Venter is a clinician researcher at the University of the Witwatersrand. And Professor Venter speaking to us about the impact of the U.S. funding freeze on HIV response in South Africa, and also what government needs to do in order to make sure that we don't regress.